Good morning, everybody.
Okay. Good afternoon, sir. I'm your listening, sir.
Good afternoon. Today, we'll discuss about newer technologies for current challenges in pediatric surgery. So, I want you to hear actually what are the ideas from pediatric surgeons across the world, not only from Yoga Nagendhar or our pediatric surgical team, but overall. So, to start with about newer technologies, so we should understand why pediatric surgery needs innovation. Pediatric surgery itself is a special niche branch, so where we'll be dealing with very small kids, and our branch itself is really a very young, tender, small branch. So why do we require? Because children are not just small adults. So they need specialized technology, specialized environment, specialized people. So for that reason, actually, pediatric surgery should be seen separately, and that's why actually whenever actually you have a pediatric surgical problem, you should be going to a pediatric surgeon, means the surgeon who is going to deal with the kids, and because each and every baby is different. So we treat anywhere from newborn period to 18 years of age. So you can understand 18 years old will be around 50, 60 years. That means you treat pediatric patients. Almost like us. So almost like us. So a newborn, he'll be very small. Actually, mm, something like 500 gram who requires an operation. So for that reason, pediatric surgery is totally different and needs to be handled totally differently. And each and every baby is separate and should be considered separately and differently. So that's why pediatric surgery is totally different. So, and finally, actually, whenever a pediatric surgeon is operating, we don't see just one day baby or few years. We, in fact, actually, whenever the baby comes to us, we see the coming 70 or 80 years of his lifetime. So, and then we give any treatment according to the lifetime of that patient. So, something like you can understand, actually, you are thinking 70 years ahead and giving one option of operation or whatever it is treatment. So, in pediatric surgery, the most important thing is precision, because a slightest mistake on this side or that side is going to be very costly for us. So that is the reason why pediatric surgery is very special, and that's why technical innovations in pediatric surgery are totally different, and it is required every day. So, so what are the key challenges in pediatric surgery? So there are several key challenges. For example, common things that we see are correctable congenital malformations. So correctable congenital malformations also, actually when we are giving one correction, we should think about the long-term consequences and if these things are going to affect the kid's life in any way in the coming future. So that's why we have to be very careful. And coming to the neonatal fragility, so kids are very fragile, as you can understand. A newborn, frankly speaking, I often tell actually you can't pinch the skin of a newborn child because it is so delicate. Sometimes actually even you feel as if actually the outer layer may come out. Is one. Second thing, the fluids that we manage, we have to give everything according to the milliliters. So we can't give more. So we have to be very careful. Even if slightest mistake happens, it is going to cost heavily for the child and for the family and for the doctor as well. So that's why we should be literally on toes and continuously will be keeping an eye on those patients. So they're very fragile. And while doing operation also, we have to manage the temperatures, we have to manage the fluids, we have to manage the doses. So doses will be literally not in milligrams, it will be way beyond, way below milligrams. So that is the dosage requirement and the fluid requirement or the temperature requirement or overall. As you can understand, if these things are also there, so obviously the pediatric surgeon's eyes and pediatric surgeon's hands should be equally more delicate in dealing with these fragile newborns. And over that, though the baby is there with the families for only few years, the emotions and practical aspects with the babies are very high. So a newborn or will be treated. It means it's purely, frankly speaking, actually, as every parent can understand, uh, it is a product of their hard-earned love and affection for that baby, and it's we all consider a newborn as a God's gift to us. So that is so special for every parent, and especially the mother, and that's why automatically the parental expectations about these kids will be very high. So coming to the pediatric surgery evolution, so pediatric surgery evolved over several decades in totally different way. So once upon a time, even a surgery for the matter of fact, once upon a time they used to do without any anesthesia. Anesthesia improved, technology improved, and expertise also improved significantly. Especially in pediatric surgery, it has doubled or tripled actually significantly. So what we have been following actually some 3 or 4 decades before, we are not following that nowadays. And we are total means not following means basic principles are made the same. The technology and the technological expertise that we are utilizing on these babies are totally different. So, for example, like from open surgery, we moved on to minimal invasive surgery, which includes a laparoscopy and advanced laparoscopy. And when we use it in thorax, it is called thoracoscopy. When we do it in the urinary bladder, that is called vesicoscopy. So, in that way, actually, the technology is increasing so much. And sometimes we are going inside the lumen and inside the holes, and then we are doing what are called endoscopic procedures. So, these are also therapeutic. So these are also making a significant change in the pediatric surgery evolution and in the progress. And the latest technology that in KIMS Cuddles we adopted is robotic pediatric surgery. So this is a very high specialized branch of pediatric surgery where we are utilizing the uh, AI robotic technology into the pediatric surgery. So the precision that we are going to give is immensible. So coming to the minimal invasive procedures, what are the main advantages as a parent, as what all you should know? So, so incisions are significantly reduced, and incisions are giving beautiful scars, and which may go unnoticed, may not be able to be noticed by a pediatric surgeon also. Sometimes I'll be surprised to see that actually I'll ask the parents actually where are the cuts that we made. Sometimes I get a doubt actually, is this a real patient or someone else? Means for the surgeon's eyes itself, we may not be able to see the scars. So beautiful will be the scars in a minimal invasive surgery procedure. So definitely, because we are not doing too much of cutting of the muscles and all, the brain reduces significantly, and the recovery is really fast. And overall, the cosmesis is what is more important in this era. So because the parent, the kid should not ask in future, "Oh, Papa, Mama, why did you get this big cut on my body? Is it because of the money?" It's not because of the money. It is we have to go according to the technology. We have to go according to the flow of the evolution. So coming to the advanced pediatric laparoscopy procedures that we do, there are several procedures. Actually, wherever we are able to apply, we are applying. So be it for the kidney, be it for a mass, be it for abdominal cyst. So wherever it is possible and feasible, we are using pediatric laparoscopic procedures, even in advanced procedures. So everything we are able to do it with 3 or 5 instruments. That is a reasonably beautiful cut, and which is going to give beautiful cosmesis. And visualization in laparoscopy is significantly more than what we see in the direct naked eye. So over and above this, actually, the robo is going to give us actually some more added advantage of visibility, malleability, maneuverability, and the degrees of movement of like like this. And overall, in all these procedures, the trauma to the baby is very less because in laparoscopy or minimal invasive surgery, we can't go here and there. So that's why actually we just go directly to the target, finish the work, and can come back. So actually, and suturing also is very simple. Actually, in 5 minutes, actually all the suturings will be over. So that's why the trauma that you're going to cause to the baby is very less. and kids tolerate these minimal invasive procedures very well. So coming to the robotic surgery in children, and from KIMS Cuddles as a pediatric surgeon, I'm very proud to tell that KIMS Cuddles is the first pediatric robotic hospital to start robotic surgery for children. So that is a very proud moment for us, and we have done almost all the advanced minimal invasive surgeries robotically, and it's a proud moment for all of us. So, what are we achieving by robotic surgery is the important question. So, because robo, as you can see in the picture, it is very big machine. So it will be connected to the baby, and then surgeon will be sitting in the console, and then he'll be operating from the console. So, uh, so it is a totally different thing. But why are we applying this robotic surgery in children? Why are we applying this such a big instrument on the children? Very costly equipment and very precise equipment, very highly advanced, technologically demanding surgery. So why are we applying it in children? It's an important question because the precision that it is going to give to the surgeon is too good. Whenever our precision is good, automatically the work we are going to do and the perfection that we are going to give is going to increase tremendously. And coming to the suturing techniques also, we will give the exact precise suturing actually wherever it is required in robotic surgery. And complex reconstruction procedures in complicated places is feasible and possible with robotic surgery. So this is the beauty of the robotic surgery, and successfully we have done actually almost all the advanced robotic surgeries. So this is my team. Actually, we are being actually uh, appreciated in the recent paper publication, and it is about actually how robotic precision is making surgical procedures safer and more effective for kids. This is my team. Actually, I'm Nagendhar. Along with me, Dr. Manisha, Dr. Avinash, Dr. Ashish. The team of 4 pediatric surgeons will be covering KIMS Cuddles, Kondapur, Gachibowli, and Secunderabad. And we are very happy to tell that actually we are giving the perfection and precision that is possible anywhere else in any part of the country or anywhere in the world that we are able to achieve and give in this from our KIMS Cuddles. So, coming to the neonatal surgical advances, there are various technologies, and most important, actually, I should not be starting or ending without appreciating our pediatric anesthesia group, because pediatric anesthesia has evolved significantly in the last half decade, and it has evolved to such an extent that even for 500-grammer baby also they'll be able to give a successful anesthesia, because anesthesia is key to start any pediatric surgery. So we as pediatric surgeons, we cannot do even one single surgery without a good pediatric anesthetist. So and technology also in the anesthesia, also the drugs, actually what they use for adults is totally different, and what we use for children is totally different. The amount of anesthesia which is required for this particular baby will be decided by the pediatric anesthetist exactly to the precision which is required. So, so anesthesia is adding more value to a pediatric surgery success outcomes. And the miniaturized tools means in a adult operation actually we'll be using long instruments, but in a child actually which where we'll be requiring actually almost short length instruments, what we call. So we'll be using that. We'll be using actually finer instruments, means they're so fine that they can handle only up to some fine suture materials. Beyond that, what we use in adults and all, those things cannot hold, and if you try to hold it violently, that instrument is going to break. So our hands are means trained in such a way from our pediatric surgery days, and with advances, our hands are trained in such a way that actually we'll be able to handle the delicate babies with that much of delicacy only. Means we have to handle them with care, so that we are tuned to and we are used to it. That's why pediatric surgeons, if you ask, actually, though we have the expertise of general surgery, we have done 3 years of general surgery before pediatric surgery, but we never touch adult operation because our expertise will get spoiled. So we are pediatric surgeons. We live like a pediatric surgeons and happily, royally, richly. as pediatric surgeons. So that is what a pediatric surgeon does. And uh, and finally, our outcome is going to be deliver the best possible safe outcomes to the babies. Even newborn surgeries also. The handling, the suitabilities that we are using, the temperature, and the fluids that we use also are pre-warmed fluids rather than regular fluids that we use for any other operation. But all the fluids, actually, even the painting fluid also will be pre-warmed, and all these things are not possible without the advances in the investigations. And I have written navigation also. The navigation also is adding to the uh, give a precision of our work. So the imaging, the ultrasound that we are using is a very high resolution ultrasound, and it is able to pick up so many finer details also. So thanks to our fetal medicine branch colleagues, so where in the antenatal diagnosis itself, they are able to pick up the items, and then they are able to tell this patient's kidney is means it is swollen to this extent, this baby's intestines are swollen to extent. That's why in prenatal diagnosis itself, actually we know what this baby is having. So that's why we are able to do antenatal counseling from the prenatal life itself, and then literally we are preparing the families in the prenatal life, means in the when the baby is in the womb itself, we are preparing the parents how the life of the baby is going to be, and what you should be doing, taking care, when you should be doing the operation. Is it immediate operation? Is it, can we do it later? All these things will be decided. To such an extent, actually, the parents will be given a choice whether to deliver in the center where a pediatric surgeon is available, or they can get it delivered in their place and then come for us for showing the baby or getting the surgery for the baby. So there is one more thing called intraoperative ultrasound also. So what it will do is intraoperative, actually on table, actually the radiologist will come and help us with the diagnosis, because if at all, if we are missing something, are we going to the exactly the perfection? So these details actually we can get it done by doing what is called the intraoperative imaging or intraoperative ultrasounds. And nowadays we are using what is called as a fluorescence guidance. Actually what we do, we have a separate camera that will decide actually what is the blood supply for this organ. So on table, actually we'll be seeing the blood vessels, and then we'll be going according to that. And this camera is going to help, and with the one injection shot we'll be knowing actually what is the fluorescence blood supply for this area. And with all these things, the expertise that these radiologists or the medical doctors are having is increasing as the decades pass by. So that's why they're able to deliver improved accuracy in their work. So there are several innovations in pediatric urology to start with, and the pediatric urology innovations that we do are the robotic pyeloplasty that we are doing, and there are several laparoscopic reconstructions. And so, for example, actually a pyeloplasty, actually earlier days, actually when we were doing actually our post graduation, we used to give a cut of almost this size, and then actually we'll be delivering the same operation. Operation was that's why I'm telling basic surgical principles are same. Over and above that, the technology is changing and giving us the best possible outcomes. So, for example, actually laparoscopic surgery to robotic pyeloplasty. So we are able to do the same operation in a different angle and different style with advanced technology procedures. And laparoscopy also several various reconstructions we are able to do it. And after all, because the earlier referral, earlier operations, and the timely operations that we are doing, we are able to save the kidneys and nephrons to the earliest possible time, and that too with less morbidity. That is because the more and more you wait on a problem, the problem is going to increase. Problem is going to cause more damage. This damages and all we are reducing by doing a early procedures and definitive corrective single operation procedures whenever it is possible. So this is a picture of a laparoscopic pyeloplasty that we have done. You can see the precision actually with which we are able to see the beauty of that. So literally it is as if actually we are going and seeing close to it. So robotic pyeloplasty, it is one step ahead. Actually, what the advantage what it is giving is the precision and the vision that we are having is as if not close to it. It is as if we are inside that or just on that. So that vision is definitely going to be much superior to what we are seeing with the naked eye. So automatically the precision and the perfection that we are giving will be uh, double, tripled, and many fold increase. So the beauty of this robotic surgeries is the maneuverability. Actually, our hands have got some restrictions, so that restriction also is lost, and then we'll be having actually almost a 270 degrees actually mobility with a robotic instrument. So this is a laparoscopic ureteric reimplantation, actually which is done for actually if there's a block in the ureter or if there's a reflux in the ureter, we are doing vasoscopic implantation. Vasoscopic means we are going inside the urinary bladder. That itself is very small. We fill it, and then inside the urinary bladder, we're doing this operation. It is very difficult. Similar way, same procedure can be done using the robotic technology. So as you can see, the hand instrument, the tips, actually the way they are moving, it can move to any extent. So the precision, it is going to increase significantly, is what we are going to achieve. So there is a new technology called enhanced recovery uh, after a surgical procedure. So in the anesthesia and in the surgical recovery, we are planning for what is called as early feeding. So early feeding and safe anesthesia, anesthesia only for the required amount of the time, and then along with that, actually, we'll be adding a little bit of pain-free period also after the anesthesia is done, because during anesthesia, kid won't know the pain, but after the anesthesia weans off, the kid will start knowing the pain. That's why we give actually a pain relieving blocks or any local anesthesia agents. So overall, by doing all these things, actually, and we are trying to reduce the hospital stay. Earlier days, actually, when we were doing, actually, we used to get the we are studying, or before that, we used to keep the patient in the hospital for 7 days or 5 days at least. But nowadays, we are trying to do more of daycare operations or 1 day operations or maximum 2 days operations. So, and then we are trying to ambulate the patient, mobilize the patient, and send them home. Because for kids, the best place for recovery is his own home with his own equipment, environment, and armamentarium, and with everyone around. That is the healing agent that the kid wants. So, whenever any technological advance happens, it is because one procedure will be identifying the need and then or necessity for a better intervention procedure. And in that, we'll start doing some research and then we'll adapt to the local context and then we'll come up with a new technology. And this is how uh, necessity will be studied and it is put into action and one plan is created, and that is when we implement that plan and then we'll come up with a newer technology. So Indian healthcare perspective is increasing significantly. That's why actually we are getting patients all the way from other parts of the countries also. Apart from our other international patients, they are coming to us for getting uh, utilizing our expertise, and this is how we are expanding. And then we get actually right now we have patients from Zambia, Somalia. They're getting treated by us. uh, that is how actually we are able to increase fame and pride of India, and we are trying to achieve in modernization of the India and little bit of contribution from the pediatric science as well. And in future directions, we will come up with still smarter instruments and instruments actually which are utilizing the AI facility. And then this is where we are going to give the precision in pediatric patients. And interestingly, most of them are technologically driven. And for each and everything, we have some safety protocols, and we follow those things only after time tested uh, in the instruments. Then only they will be applied on the pediatric kids. So current future trends in pediatric healthcare are more towards telehealth services, and we are trying to give personalized care, and our most important focus is on the prevention. So technology improves outcomes. Minimal invasive is the future and is going to be the future. And AI has come in to live with us, and we are going along with AI to give the best possible outcomes to the babies. And yes, before that, all of us are going to go through a training process, and then nowadays actually we have child-centered care centers. So that's why actually that's why I always use the word children are not just small adults. So they can't be treated as a half adult or one fourth adult. He's different. Every kid is different. So though I'm a pediatric surgeon, a 1-year-old kid is different, 2-year-old kid is different, and 18-year-old kid is different. And just born or the baby in the womb is totally different. So each and every baby is very different in pediatric surgery. Unlike in adults almost all of them are more or less same. Only two types will be there: adult and elder, very elderly. So that's why at the kids pediatric surgery is totally different. This is the key take home message that I want to give. One last word of advice I want to give for all the patients of and mothers of the kids who have surgical problem or who is dealing with the doctor. Listen to the doctor's advice. Doctor, whenever he utters a word, he is thinking twice to give you that advice. So when he says something or she says something, that means try to follow that. So every word that we utter has some sense and with so much of knowledge. So whenever actually in our team, or not only for our team pediatric surgeons, anywhere else, anywhere, be smart. Yes, kids are annoying in while conversation. That's why usually two parents will come. One parent should be concentrating on us, one parent should be concentrating on the baby. So so this way, technology has changed a lot, and we are coming up with newer technologies. And I'm so proud to tell that KIMS Cuddles, our pediatric surgical team, is giving the latest technological advice and latest technological equipment and expertise for all the babies wherever it is required or necessary. So, and my sincere appeal to all the parents is come once. If you want to come and once again get the doubts clarified. So with all the doubts clarified only, you please come to us for the surgery. So till that time, there is no hurry, and only there are few emergencies, of course. At least there where not much of choice is there, but otherwise most of the operations in children are elective operations, and this is mainly to stop the damage, mainly to control the damage. So these are called damage control studies or surgeries. So to prevent any further damage which may occur by delaying, by purely because of the parental fears, so it should not happen to the kids. So kids should be protected by little bit of strong, mentally able, mentally strong families. So be confident about your pediatric surgeon, and just listen to what he says, and then after that you can do your groundwork, get all your doubts cleared, get the surgery done, and give the best possible outcomes to your babies. So I'll go through a few of the questions that are there in our chat box. So so one doubt that we have is, are advanced pediatric surgeries more expensive? So I was telling earlier, it's a open operation. You have to stay in the hospital for 5 days, 7 days. So if at all, if you see the number of the days and then calculate the uh, money accordingly, so it may be costing you more. But thanks to the advance in pediatric surgery, because initially when it comes to the practice, it will be very costly. But as the years passes by, because of more types of equipment which are available, we definitely the cost will come down. Initially, yes, it will be more, but as it increases, the cost will come down significantly. So that's why if you calculate risk versus benefit ratio in that way, so the newer technologies are definitely way better than older technologies. So don't worry much about the expenses. And frankly speaking, I always tell money should not come between the patient and the doctor. So our care should be according to the patient, not according to the cost wise. So yes, but definitely cost will come down significantly, and as we go for higher advanced technologies, definitely it will be a little bit costlier than the open operation. So it is purely parental decision which option they want to take. So we won't force any patient when they come, doctor, I want open operation because I cannot afford. Then we won't tell actually, no, 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 you should get it done because that is better the equipment. So I from the beginning, I'm telling only one thing: the basic surgical technology, basic surgical principle, everything is same. So regarding that, we need not worry much about the procedures. So again, one more person is asking, um, is robotic surgery facility available in KIMS Cuddles? Yes, from the beginning, I'm telling the same thing. Our KIMS Cuddles is the first pediatric hospital to start the robotic pediatric surgery. I'm very proud to start that. Since 1 year, we have been doing this successfully, and we are doing very good job. And it is there in adults actually since long time, but nowadays actually um, it has we are using it in pediatric surgery. Usually it happens like this: first it is time tested in the adults, and then actually it will come to the special people like kids. So that's why only after testing in the adults only we'll be coming to this pediatric patients, and we are able to successfully give actually good results with kids with the newer technologies. So there's one more question: will there be big scars on my child's body? Yes. Coming to the open operation, laparoscopy operation, robotic operation, the here what is happening is with the advances, the technology, the outside technological armamentarium that we are using is increasing in size. But luckily, the reverse is happening. The big cuts are becoming smaller cuts and with almost minimal cuts, which are almost negligible. So the scars that we are going to leave on the child's body with the recent advances are significantly much lower and much acceptable and more happily accepted by most of the families. So this is the beauty of the latest technology. If at all, if we are leaving bad scars on the baby's body, definitely it is not a very good option. So we should not take that. So that way, uh, the technological advances are very good, and we are preferring actually minimal invasive surgery as and when wherever it is required. So thank you all for your patient hearing. With this, we'll try to close this session, and then let us meet on at 3 p.m. next Monday. Every Monday, we are planning to have at least pediatric surgical series, and let us discuss about the common pediatric surgical problems and in our coming Monday 3 to 4 sessions.